have, presentation and discussion. So I'm going to pull those up if that's okay, Danica. I always have like a million tabs open. So when the share screen thing pops up, it's like, oh, don't click the wrong thing. Can I just get a confirmation that you can see PowerPoint slides?
Yep, can see them.
Thank you very much. Okay, so let's go ahead and get started. I know that you all will be having a listening session after, so don't worry, I will be very mindful of time as we are presenting these slides and having these conversations. So in terms of just kind of looking at like what we're going to be presenting and kind of talking about today. So, we recognize there may be a mix of individuals on the call today that maybe like have heard of SOAR, but aren't really as familiar with like what that means or looks like, versus, as well as a combination of those that are like very familiar with SOAR and have been trained and or maybe doing applications. So really what we are hoping to do is share the importance of Social Security disability benefits and provide kind of like a brief review of the SOAR process, most notably the critical components and why they're important to this process. We want to absolutely offer opportunities for community organizations to connect and ask questions about the process. So when we start the presentation, we're going to start off kind of like broad, right? Talking about kind of like the basics of SOAR in general. We'll narrow in a little bit in terms of like looking at Austin specifically. And we absolutely as well, encourage you throughout the time that we're having this presentation, if you have questions, thoughts, things that you feel like are related to community barriers, you can feel free to, put those questions in the chat box. We will absolutely hold space to have those to be able to answer as many questions as we can. Again, as I stated before, and we'll talk about this a little bit later, but the city of Austin, Travis County has absolutely been a high performing community in the state of Texas, which I hope that you all are very, very proud of, because I know that we are very, very proud of you all. There's been times where I've looked at Austin's outcomes and I'm like, dang, like if it was just the city of Austin siloed and like the rest of Texas wasn't included, like if we just looked at Austin's outcomes and not like include the rest of Texas's outcomes, the city of Austin, like during some years at some points would have been like amongst our top 10 like states that we do every year, because the outcomes were just that good. So we're very proud of you. And, again, like as if there, if there are community barriers and things like that, we are certainly open and here to listen, how to help you creatively problem solve and brainstorm. And then we just ask that in return, that as we are presenting information, that you also are just kind of committed to being, to receiving the information, open and honestly, and really kind of having reflective, open, honest kind of thoughts and questions and conversations and reflections for yourself of, okay, this is what the SOAR model is. These are the critical components. How does that relate to what we've been doing with our agency or with our staff or with training? Do you know what I mean? So again, I think that if we are all able to kind of openly and honestly listen and kind of like reflect, that we can really kind of come up with solutions to ensuring that this process still continues to work as well as it has been. All right, so we are going to start off with kind of like a little bit of a SOAR overview, kind of like the basics, okay? And if you have questions, again, put them in the chat box. And Shandraia, I apologize, but if you don't mind kind of like keeping tabs on the chat to see if there are questions, because it'll be hard for me to like look, and then I can ask at like the end of each section. Thank you, I appreciate you. Okay, so looking at kind of like what is SOAR, right? We keep talking about SOAR, you keep hearing SOAR. Like I said, even if you aren't like necessarily familiar with the SOAR model or process, you have probably, if you were living in the city of Austin, you have absolutely heard of SOAR. So SOAR stands for SSDI Outreach, Access, and Recovery. And what it is, like in terms of its most basic sense, how I encourage you to think about, SOAR is a model, right? Because there isn't necessarily a direct funding stream for SOAR. Doesn't mean that it doesn't fit into many other funding streams, but there isn't a direct one for SOAR, right? So you might hear people say, I'm looking for the nearest SOAR agency or program, or like, do you know what I mean? SOAR itself is not a program or an agency. SOAR is a model. It's a way in which someone is trained to be able to put together complete applications, disability applications, for an individual who might be experiencing homelessness and or at risk of imminent homelessness and have a serious mental health, co-occurring substance use disorder, and or other physical disabilities. So SOAR is a national model. It's been sponsored by SAMHSA and the Social Security Administration since 2005. And as I've stated, it's a national model. All 50 states and Washington, D.C. currently have SOAR initiatives. Again, because it's a community-led initiative, it may look differently in each state. or the amount of resources that are put towards it might look differently in each state, but you will absolutely find SOAR initiatives in each state. So as I've stated, right, like I mentioned that SOAR is a process, right? So when we say SOAR or a SOAR application, we're not talking about like, there's not a specific form where it's like, this is the SOAR application form, right? We are assisting people with filling out and completing the standard disability application forms, but SOAR is the process of how we do that, right? So it's the way in which we are doing that. Now, oftentimes I like to sit here and I like to kind of ask individuals, and you can feel free to throw some numbers in the chat box. I'm curious to see. So if I were to ask you, what do you feel is the current approval rating for an individual putting in a disability application? Not even like SOAR wise, just in general. If someone like, what do you think is the current approval rate or allowance rate for those that are applying for disability on their first go around by themselves? And you know what? I can't even see the chat, so I don't know why I was sitting here waiting for numbers to pop up, but I'll just go ahead and tell you. So the current initial approval rating is about 29.8%, which has actually gone up over the last couple of years, which is good, right? 29.8%. When you look at SSA's data set reporting tables and you filter for individuals who are experiencing a severe impairment and experiencing homelessness, that number falls to about 17% chance. A 17% chance of approval rating. First go around, submitting an application, like I shouldn't even say first go around, but just like submitting an application in general on your own. 17% chance approval rating for the folks and individuals that we serve. And the thing is, oftentimes when you look at like these applications, it's not that those individuals don't have severe impairments, right? It's not that they don't have these severely limited impairments. It's that the necessary information to demonstrate how severe they're limited was not necessarily included in that application. You know, and I'll say that again, right? The necessary information to show how severe their limited functioning is oftentimes are not included in that application. Oftentimes, many individuals operate from the assumption of, you know, well, I have this diagnosis, right? I have schizophrenia, or I am diagnosed with epilepsy, or I have seizures, or things like that, right? And oftentimes, many individuals, including providers who may not necessarily have education on in terms of putting together applications, often take the assumption of like, well, they're diagnosed with this, they should qualify, right? And I think many of us in this work know that simply having a diagnosis, that by itself does not mean that a person cannot work, right? That doesn't mean that you can't work. Absolutely not, especially if there are those of us on this call from the peer or recovery world or individuals with lived experience, which I am. We know that having a diagnosis does not mean that you are limited and cannot work, right? So, you know, individuals that kind of take this assumption of like just looking at simply medical condition and diagnoses, they often aren't, you know, oftentimes those applications just simply might include information showing that, hey, they have this diagnosis, this diagnosis, right? But I could be diagnosed with schizophrenia, and Shandraia could be diagnosed with schizophrenia, and we could experience it in completely different ways. And there are maybe things that Shandraia does where she's able to still then kind of manage her day-to-day living, her functioning. That doesn't mean that she's not going to have bad days or have symptomatic days, right? That's part of simply having schizophrenia. But as a whole, she is able to function and go about her day-to-day, right? So the point of all this rambling that I'm telling you, right, is that SOAR providers are trained to not just simply look at, here's this person's diagnosis, but to also then take it a step further and provide information. And sorry, if everybody can mute, I would really appreciate it. Thank you. But they're then taught how to gather and provide information that demonstrates, hey, this is their conditions, their symptoms, their diagnoses, and this is how it has severely limited this person's ability to function, especially in a work setting and to maintain work. So as Dazara kind of like stated or implied, you know, when she was introducing herself, right? SOAR was really, the SOAR critical components, I should say, because SOAR has progressed and looked differently over years. But SOAR was really kind of born out of like, here's this population, those experiencing homelessness or at risk of homelessness, here's this potential tool to help them get stable disability benefits, right? Why are they not able to access it? Like, where is the barrier? Where is the gap? So really at this study from the early 90s looking at like, what are the barriers and like, how can we like address those gaps? So from that, long story short, from that study, we have the SOAR critical components. So now, as I've stated, right, when we talk about SOAR is a model of how we are putting the application together. It is a process. So I know there are many individuals trained in Austin, which is wonderful. But if you are assisting applicants with disability, with completing these forms, and you are not utilizing the 5 critical components, it is not a SOAR application and should not be marked as so. Okay, just want to make sure that, you know, there's an understanding there, because SOAR is referring to how that application is referring to that process, that model that we're using to do the applications. If we're not including these SOAR critical components, it is not SOAR, and it should not be marked as such, and it should not necessarily be being delivered to our contacts at SSA and DDS being marked as SOAR if it does not include these critical components. And I do know, you know, Shandraia, like either Martine or you would be kind of like talking, including information from Social Security, but I will note that, you know, this is very important because I know in the Austin community, especially Shandraia and local leads before you, have worked very hard to develop the really, really great relationships that exist today. Those great relationships with SSA and DDS that exist today, they were not always there. And people have worked very, very hard to develop them and get them where they are today. And a big part of that was because of the quality SOAR applications that were being submitted. And we have received feedback over the past year that they have been receiving a pretty decent number of applications that are marked SOAR, but that do not include the critical components. And that has been causing some barriers from their end. But again, I won't speak to that, but I do want to know, like, and I'm saying that because it's important for people to know, like, when we're talking about just the critical components, like why they are important and how they affect necessarily the SOAR process and community within Austin. So listed on the chart on the left side are the 5 SOAR critical components, and I will try to briefly go through them. Okay, so the first critical component is serving as the representative. And the form that is used to establish this role is called the SSA 1696. So the expectation, if someone's completing a SOAR application for an individual, is that they're signing on to be their representative. And so as a representative, the caseworker is more than just simply a contact person, right? And sorry, let me like set the table for this, right? Because think about the individuals that we serve currently that experience homelessness and the many barriers that can like get in the way from them trying to start that application to the time that it finishes, right? Whether it's they don't have an address and the mail's getting sent there, they're missing all their deadlines, to they don't have the capacity to go and sit in the office for 4 hours, to they may have cognitive issues and can't recall. There are so many things, right? We do this work, we know. So those that are serving as the 1696 representative are kind of like a bridge between that person and the Social Security office. And that 1696 representative is able to do a number of things. Not only do they receive all the correspondence that the applicant receives, right? So if that person's transient and moving around a lot, that rep is still getting all the correspondence, knows all the necessary dates, things like that. But they're also able to speak to Social Security with or on the person's behalf, attend appointments with or on the person's behalf, be able to put that application together, be able to submit evidence for their file, being able to get information from their file. So just a number of things that allow that person to really kind of help this application move along the way it should be. The second critical component is the submission. Well, it's collecting and submitting appropriate medical evidence, right? And in order to provide sufficient evidence to document that disability, caseworkers really need to like collect and submit those medical records to SSA. And part of the training is teaching SOAR providers how to kind of like look at and know what the medical records are that they want to collect. SSA, I should say DDS, is looking, in order for DDS to approve someone for disability, depending on what the conditions or diagnosis or impairment is, they are looking for very, very specific things. I won't go super into detail. It's in the SOAR training. It's called the Blue Book listings. But like you can literally go there and click on like epilepsy. It's going to tell you that exactly the type of epilepsy the person has to have, how often they have to have seizures, what else has to characterize it. They are looking for very specific things. So you can go and collect hundreds of medical records from different places. But if none of those 100 medical records have the information that they have specifically listed that they are looking for, that person cannot be that person cannot meet that listing for disability. So SOAR providers are trained how to use the Blue Book listings to identify what records need to be collected. And also too, we mentioned, right, they collect medical records and submit them with the application all at one time. And the reason for this is that when records are collected ahead of time, it ensures that they're receiving the information that they need to make a decision, but also too, it's helping the process to go faster because the DDS examiner is not like out there trying to collect these things. All the information they need is being given to them at one time in a nice packet. Here you go. The third part of that is writing and submitting a medical summary report. This is a key SOAR signature tool and key to many successful applications. And basically what it is in its most basic sense, this isn't a clinical document. It is simply really a letter written by that SOAR provider to the DDS examiner. It kind of provides like a really nice, succinct, comprehensive summary of that applicant's personal and treatment history. And it helps to like link their diagnoses to their impairments in functioning. And so what I mean by that, because if that's sounding, clinical to you, what we're saying is that applicant, that person, that individual, right? That SOAR provider is looking at the existing medical records, things that are already there. And in that medical summary report, they're simply adding in supplemental information to be able to highlight limitations in that person's functioning, right? Do you know what I mean? So being able to add in specific examples of how the applicant has missed 7 out of 8 appointments because of their cognitive issues, right? Or adding in quotes to help provide context to situations, right? Putting in observations from the record. Do you know what I mean? If the person has a diagnosis and DDS is looking for a specific test, highlighting in the medical summary report that on this day, they had this test at blah, blah, blah medical facility, right? So again, really just kind of like having the opportunity to really kind of provide examples that show limitations in functioning for that person. The fourth critical component is obtaining a co-signature for the medical summary report. And this is a key piece as well. And that is because a co-signature on the medical summary report does elevate it to the weight of medical evidence. Now, there may be some scenarios and some circumstances where the SOAR provider is unable to obtain a co-signature, and that is okay. You still submit it, DDS still reviews it. Sometimes there's a common myth out there, or maybe some people may have been told like by DDS that sometimes they don't look at all the medical evidence, or they may not look at MSRs or things like that. The state of Texas, we have a specific specialty unit at DDS specifically for SOAR. And I, along with the state team lead, have had recent conversations with him. And he has confirmed that DDS examiners are expected to review all evidence. And then the fifth part is typically if there's some kind of like quality review. So maybe it's like a SOAR trained mentor or supervisor reviewing the packet prior to submission, or whatever kind of like community or agency type review is in there. And what we found from tracking over the years is that applications that utilize all 5 of these SOAR critical components are significantly more likely to be approved. So this is just a little bit in terms of, sorry, let me look at the time.
Hey, Sametra, before we go into outcomes, can I just address 2 questions that Dylan had with regard to the critical components? Or Dylan, or if it's pronounced Dylan, I apologize. One was, why is it important that any application be marked as SOAR? If the app is complete, what's the difference? And the other one was earlier, let's see. Want to learn when SOAR is better method than the regular disability application. So I'm just going to address both of these, right? Mm-hmm. So Sametra already discussed how without a SOAR provider, or in the general sense of applying for disability, the outcomes are what, 30%? Is that what you said, Sametra?
Like 28.9.
28 point something. We have over 65% nationally, and it's even higher in some communities. I'm thinking of an area in Pennsylvania that has like a 99%. Individually, we know that there's SOAR providers that are providing this service that have 98%. Every SOAR TA center liaison has done applications themselves with outcomes in the 90%, in the 90 percentiles as individual providers. And so when you think about those kind of percentages in comparison, it's just better in that way. And the thing that makes it better, as Sametra has talked about, are these all these 5 critical components. And then there was a question about, an app can be submitted without all 5 of these components. Is it better to wait to get all 5? Nope. But what you have to make sure, you can't do SOAR at all without being the applicant's representative. That provides a two-way communication between you, Social Security, and DDS. They can take all of your information, but they won't give you any information without it. And you're going to have to communicate with them. And you'll probably need to communicate more with DDS than Social Security, because that's the first part of the process. But the ultimate goal when it gets to Social Security is to make sure that everything is checked off for them to pass it on to DDS as quickly as possible. And so to make that medical information. So you can't do SOAR without collecting and submitting medical records, right? There's some communities that's like, well, why do we have to do double work? They're going to ask for the medical records anyway. I'm not sure if that's your experience, but in order for us to write that medical summary report, we have to see what's in the records. And it helps to make a more robust way of writing so that you can really provide the information that's needed so that the person examining the medical information can see the functional limitations in the same way that you do, because they never get to see the applicant. So it just makes sense to have all the information so that you can write in a way that depicts this individual's struggles the way that you want to be lifted from the pages so that DDS can see the person in the same way that you do. Now, obtaining a co-signature, honestly, when I was doing SOAR, the only time that I was able to get a co-signature from an acceptable medical source was if I was working with a fact team, when there was already, the forensic units that already had a doctor on staff, ACT teams that already have doctors on staff, or any other provider that had doctors on staff that understood the importance of SOAR and the people that they worked with. They were more than willing to do that. But I didn't have a signature from an acceptable medical source on every single claim that I did. But you still submit the MSR because it's still very valuable information, and it speaks to the limitations and functioning that people experience. Completing the quality review is something that, leadership within your SOAR community should institute in order to make sure that the application submitted is exactly what we say we're going to do. I've seen so many representatives from SSA and DDS say, I want to be supportive. I've been to every meeting, but we're not getting SOAR applications, or we're not getting the applications that SOAR says that they provide, because people are skipping collected medical records. They're writing MSRs that don't talk about functional limitations. Instead of giving those examples the way that Sametra explained are necessary in order to show through what we write the limitations in functioning, they just write sentences that say Dazara Ware has extreme limitations in functioning, or extreme limitations in her ability to understand, remember, and apply information. That vague sentence does not give anybody any insight to what that looks like to that individual. So we never want to not do the critical components, because we have kind of the responsibility to deliver what we say we're going to. And that creates the opportunity for buy-in for DDS. We recognize that the wait on I'm looking at right now, the wait right now for traditional claims, and once they get to DDS is 8 months right now. With SOAR claim, it is assigned examine it almost immediately. Well, that's great. And so I hope that helped to answer some of your questions, Dylan, and keep them coming.
Yeah, and that's absolutely right though, Daz, because Texas has a specific SOAR unit at DDS. There's a centralized DDS.
Which is a really great
Which is an
thing, because lots of
advantage.
communities don't have that.
No. And again, that's a result because of like good work and good relationship building. And again, and I appreciate all that information, Daz. And you know, I know like in my community as well, like in my hometown, Buffalo, New York, where I am, when I first became a local lead, and I was excited about SOAR and just talking to people. And there were so many people, I wouldn't say so many, but like the people who like said, like, we tried it and it didn't work. It's like when you really kind of dug deeper, it's like, well, they weren't really doing it to fidelity. Do you know what I mean? And again, when we talk about, I'm not saying anybody here on this call is doing that, but again, remember when we started this conversation, it's about kind of really being reflective and being open and honest. And so if there is anyone here who's kind of like maybe tried it and like the agency didn't have as much success, or you yourself as a caseworker didn't have as much success, really kind of ask yourself, like, were you following the model to fidelity? You know what I mean? Again, ask yourself those open and honest questions and be reflective about it.
And if you really feel, I'm sorry.
Oh, go ahead, Des. No, go
and
ahead.
if you really feel that you were following the model to fidelity, don't sit and just accept. You should never, ever just accept a denial if you follow the fidelity of the model. And the reason being is because that could be an indication that your referral process might need to be tightened up. Like it might not be the model maybe you're doing applications for people that may not be eligible for Social Security, which means that the concentration needs to be on how you're making how referrals are being made, who are you providing source services to, do you really understand the definition of disability according to Social Security? And the reason why that's important to mention is because we've had large communities, large localities, large agencies that take SOAR training and still walk away with thinking that everybody that walks through their door should apply for Social Security. Well, that's not necessarily true. Just like everybody that's incarcerated are not automatically eligible or ineligible for Social Security benefits. So if you're working with people within institutional settings or legal systems, then you really have to think about how are you going to provide assistance to people that might not be eligible for Social Security, because you don't have to do SOAR for people that are not eligible, but you cannot dissuade someone from applying. And so in those settings, especially if you're doing it well, once people get hold that you are the SOAR person and you're working with people in institutional settings, and they don't have the resources or they don't have a firm reentry plan, they get afraid and they grasp for things and they come for you and say, I need Social Security, because in their mind, I have no job, I have no resources, I have no income, I have no housing, I need Social Security. But it doesn't mean that they're eligible, because they might not possess the inability to work. They might be able to just find work. But because they don't know that there's like a definition, if you are not clear on what else to do, you'll find yourself doing applications for people that are not eligible. All that to say, if you're following the fidelity of the model and you're still getting denials, do not sit on that. Make sure you reach out to your SOAR TA Center liaison, your local lead, somebody to help you understand what could be the problem.
Absolutely, Des. Thank you. Absolutely. So listed here, and don't worry, I am being mindful of the time. Don't worry. We're gonna leave enough time for the realistic session. So this here right here briefly. So these are our
working now. Woohoo! This whole time.
Oh yes, Jackie. That's how I feel when I look at Austin's outcomes too. Sorry, well, these aren't Austin's, but I'll show you next. But yes. So right here, these are our outcomes. So these are, again, these are applications utilizing the SOAR model. So let me not confuse you. So the chart on the right are our cumulative outcomes. So these are national outcomes. So from all 50 states, from the time we've been tracking, I always butcher this, I think since maybe 2007 Daz or 2012 till now. So thank you.
Yeah.
2012, 7.
Wait, say that one more time.
The cumulative outcomes, are they since we've been tracking in 2012 or so?
Yes, 2000.
2012. I keep cutting you off as soon as you're about to say which one it is.
It's 2012.
Thank you.
And Sametra, we have time. If we have to email responses, I will, but just go ahead and take your time. This is good. And Dylan, we're going to get to your next question in a minute.
Okay, so thank you. So since 2000, so these are on the right side, our cumulative outcomes since we've been tracking, utilizing OATS. So from 2012, so these are national outcomes, all 50 states from 2012 till now. So as you can see, applications that utilize the SOAR model, the critical components, we are at a 65% cumulative initial approval rate. So compare that 65% to that 17% chance, 17% chance, yes, 17% approval rating that we talked about earlier for individuals with a severe mental health condition experiencing homelessness. The chart on the left-hand side are our 2022 outcomes. So we do it, well, as you all in Austin probably know, we do. When I send you all my annoying emails about entering your outcomes, we collect outcomes on a yearly basis as well. The SOAR outcomes collection period time runs from July 1st until June 30th. So the outcomes you see listed on the left side are from July 1st, 2021 to June 30th, 2022. And so in a couple months, we'll be bugging you for outcomes for 2023. So as you can see from our 2022 outcomes, we are at a 68% approval rating on a number of 4,271 total applications. Of those 4,000, 2,920 approvals and an average of 153 days to decision. So looking at the city of Austin, Texas, Travis County in particular. Looking at cumulative outcomes from 2017 until present, there have been a total of 460 applications completed. There's been 285 approvals out of that 460, which gives Austin a really, really nice, close to the national average, 62% approval rating and an average of 123 days, which is fantastic, which is wonderful. So as I mentioned earlier, Austin is the #1 performing city/county in the entire state of Texas. I believe Texas's national average, which did go up. So I'm giving the state of Texas props. We've been doing a lot of work in a lot of the other cities and communities with fidelity to model training, things like that. So the state of Texas currently is at about a, 40, I can't remember. I think it was like a 48% approval rating, which has gone up. So good for them. But as you can see, like the city of Austin has really been doing consistent work, has been the #1 performing city and county in the state of Texas for really like quite some time now, quite a number of years. The outcomes that you see here are from 2017 till now, but even prior to like 2017, there were still good numbers. It just got like progressively better year after year. And oftentimes when we go to other communities and we're helping them kind of like create action plans and brainstorm and things like that, this is actually one of the slides that I often include in those presentations, because I like to point out what some of the key takeaways from Austin are in terms of what lead to such great numbers. Key takeaways are definitely that people assisting with applications are SOAR trained in implementing the model, right? So passing the course, being trained, having additional follow-up training beyond that. So Shandraia does a great job of reaching out. It leads into the next slide. The city of Austin, I hope you all know, but if you don't know, not every community in the country has such an active and dedicated SOAR local lead as you all have here, in terms of like providing ongoing support. So monthly meetings, quality review, again, like, you know, people who are SOAR trained have to take our national training, but beyond that, you know, with Shandraia reaching out to do like specifically let you know who the contacts in Texas are and what the process in Texas is, and you know, you can always kind of reach out to her and you've got someone dedicated doing this work. Not all communities that have SOAR initiatives are, again, have the benefit of having such an active SOAR local lead. And so I just want to publicly give you your kudos, Shandraia. We've had really, really great local leads in Austin for a while, but you have really, truly taken it to another level. And we're very, very grateful for all the hard work and dedication that you've shown. You know, we really, really thank you for like having us on to have this conversation today, but we have full confidence in you continuing to lead this initiative in the city of Austin. And I don't know if Jasmine and your supervisors are still here, but if they're not, somebody at ECHO, please pass along our appreciation for all of Shandraia's hard work, because I truly believe that Austin would not have been able to maintain and actually improve to the numbers that they are now without such an active SOAR local league. So I'm going to publicly give you your kudos. You do a fantastic job. Another key
Thank you.
takeaway. You're welcome. Another key takeaway from Austin as well is just there's very active collaboration between SSA, the DDS, and the SOAR provider. Again, really, really great relationships here. I do believe for, if we were looking at just 2022 outcomes, Austin did dip a little bit to 59%. That's still a really great approval rating. And really, like, when you look at the dip, that's pretty common across most communities. Unfortunately, 3 years out from COVID, unfortunately, there's still really a lot of kind of delays in processing from the SSA DDS end. So I wouldn't say that it's necessarily like an Austin specific thing when you really kind of compare to other cities within that region as well. So this right here is kind of like a little bit of a deeper dive into Austin's outcomes, but with the critical components. So when you looked at those high numbers in Austin, so this is looking at, so remember, there's been a total of 460 applications. So of those 460, all applications, all providers, everyone who did those applications did the 6096. 91% of those 460 collected medical records. 66% of them did medical summary reports. 35% of them have it co-signed. 53% of them have a quality review done. So the point of me really kind of showing this slide here is that, as you can see, like the wide vast majority of those applications included the SOAR critical components. And it's really interesting when you kind of do like really kind of like deep dives on the applications that were denied. And really, I wish I should have like cross compared on this chart, but there wouldn't have been enough room. You wouldn't have really been able to see it. But looking at like how significant, when you really kind of cross compare and look at like those that were denied and like kind of the lack of the use of the critical components. And another thing too, as well, just in terms of SOAR in general, and if anyone really kind of wants to like look at the studies and things like that, I would be glad to send them your way. I don't want to like bore you, but I do want to note like the SOAR model, I mean, it's a national model sponsored by SAMHSA and SSA for a reason. The SOAR model has been tested and measured for nearly 2 decades. In terms of the critical components, it's been tracked and analyzed in terms of the impact that it's had on applications, that there have been a lot of different kind of statistical comparisons. You know, and again, what it really shows is like when SOAR is being done to the fidelity of the model, it works. And again, and if anyone is interested in those studies, I would be glad to send them along. Just didn't want to bore them with you here. So just really kind of briefly, right? I mean, I know many of you, you know, again, you're in this work, you're in this field and you know this, but I just always love to talk about it, especially being a person with lived experience, with mental health and homelessness. But like, why is this all important? You know, as we all know, right? Like when we're helping somebody apply for disability, it's really not just about getting someone a check or getting them on government rolls, right? I promise you, if you were to go to like any of your clients, your applicants, and to kind of ask them what their recovery goals are or what their goals are, there's honestly probably not one goal that like having stable income would not make that goal more achievable. I challenge you to find one, even if it's like a goal of saying that they want more friends or having a girlfriend. More money is going to be able to help them take that girl out or that boy out, right? So it's really all about helping people get income supports to help them be more stable, productive members. We don't want them to be members of our community. And I think too, like along with that, obviously, like because of the work that we all do, the most obvious thing is getting access to income is gonna most likely help somebody be able to get housing or like maintain housing, right? Because this is a long-term income support. But also too, I think a really important one, especially for a non-Medicaid expansion state like Texas, is the access to healthcare, right? So in terms of like, if someone's approved for SSI, being approved for Medicaid, or SSDI being approved for Medicare, I think it's really important. I was literally just reading a report the other day, and I can't remember the specific number, but it was just kind of talking about like, it was kind of like breaking down the number of like uninsured people in the US. And it was a pretty high number of like with Texas, like it was just a very high number. And I wish I would have loved to mention it now, but who cares? I don't want to ramble. The point is though, right? Like in a state that's a non-Medicaid expansion state, helping individuals get connected to these federal benefits, like having access to healthcare is going to also be a part of that, which is really important because when we talk about wanting people to engage more in treatment and have access to greater treatment, right? Healthcare is an obvious barrier for many, many people. I can tell you right now, the absolute worst emails that I get at the TA Center when it comes to people reaching out looking for help are the people that are saying, you know, there's no one in my area and like, I don't have health insurance. Like, how am I going to get my meds? But they're absolutely the worst ones for me. I don't know about you guys. Those ones are the worst for me.
Mhm.
But aside from that as well, again, because as a person with lived experience and individuals with disabilities don't always just have to get to, you know, stay on disability their whole lives. But I think really kind of making note that post entitlement, right? So post approval, when someone's approved, that there's so many opportunities as well to save for education, to save for, you know, for employment opportunities. They have many incentives to go back and try out work. So again, just like looking at how income is like that nice brick from which somebody can really grow from. And then really briefly, kind of looking at states and communities, how they benefit, because it's not just the individual, but when we're looking at bringing federal dollars back into the state or back into the local city of Austin, some of the most common ways we see that are healthcare providers being able to recoup the cost of uncompensated care. So again, in a state like Texas, which is a non-Medicaid expansion state, if someone's approved for benefits, healthcare providers can bill Medicaid for like any kind of healthcare provided within the past 90 days, which is big. And I wish I had, I don't have the number there. I'll say, I wish I could show you the number, the large Medicaid reimbursement number for some of our states, like North Carolina is an example. And it was like, it reached into like the millions, and it was only off of like a couple people too. It wasn't even like, it was maybe like 16 people, and like the amount of the Medicaid reimbursements was like, it was like $1 million or something. But looking at states and localities recouping the cost of public assistance, of course, back payments being paid in the community. The whole point is that like, it's literally a win-win for everyone, right? But of course, SOAR does not exist in a vacuum. It requires community collaborations, right? And we can always kind of have conversations if we feel that there are barriers in Austin. We can always kind of have conversations about how that can be improved. Lastly, in this section is just kind of looking at like kind of like the SOAR like structure in terms of the key players. So there are the case managers who are, of course, are wonderful valued SOAR providers doing the applications. There's Shandraia, the local lead, who really kind of directs local implementation of plans. There's a state team lead, Lila Ordana. She couldn't be here today, but she kind of directs plans, like plans for Texas statewide. And then there's me at the TA Center. And the thing is in Austin, y'all are very, again, like y'all are like blessed with so much support there. It's like, oh, I wish you could see like the struggles of some of our other like communities or states who don't have a lot of these things. But you guys have a lot of like local support already, where like you probably wouldn't even like need to reach out to me, but like reach out to me at any time. Anytime. It could be as simple as I don't know where to find this form, or I don't know what this question means. Feel free. So I just want to pause for a second. Have there been any other questions that have come in?
Yes, let me see. It was maybe two by Dylan. I'm gonna try to grab that last one if I can find it.
And Daz, I apologize too. I don't know if you want to add anything onto that. I feel like I've been rambling.
No, if you
Okay.
need a break, I could start from here, Sametra, if you want to. But
No worries, Daz. I just wanted to.
yeah, I'm
Okay.
good.
I
So
found
there
it.
was a question some dialogue that Dylan and I had, basically asking questions about collecting medical records. What
Mhm.
happens when you don't have good medical history? Why would you submit a SOAR application, submitting medical my question to him was, why would you submit a non-SOAR claim anyway? Because his question had to do with
I have it right here. And,
okay, go ahead.
submitting medical records at application is not a requirement for a non-SOAR application, right? But if you indicate the applicant is homeless, it will be assigned faster anyway. So our local SSA is asking us to make sure that we submit work history and function forms up front. So it won't be an insufficient denial when the claim is passed on to the DDS examiner, and they only give you 15 days to return it. Now they're lenient with us because we have our specialized unit, but to avoid that insufficient denial, go ahead on and submit those two forms up front. We hold off on submitting medical records at SSA unless it's a Terry claim or compassionate, something like that. We submit medical records through the ERE once the claim is assigned an examiner. So we do that. Homeless claims versus SOAR claims, they will get that flag. Yes, they will. Let's see, what else?
So understand that Social Security's definition of homeless is different from the SOAR definition. Our SOAR definition is much broader than Social Security's definition of homeless. So you could have a claim that's marked as SOAR, but it's not considered homeless according to Social Security. So make sure you're clear on those definitions. Always mark all the claims that you do as SOAR claims if you're using all the critical components.
And another example is recently we had an organization that submitted a lot of claims without using SOAR of individuals experiencing homelessness, and the claims was incomplete. It was just a stack at the SSA office contacting us asking what's going on, basically. So that's why it's so important to use those critical components to really know what we're doing and not just trying to fill out some forms quickly and get it over to SSA. Because if certain things are not done, it's going to slow the process down and it's going to jam up the system with the rest of us trying to submit actual SOAR claims. And if it's not submitted online and done properly, that SOAR rep, that SSA rep is going to have to manually type things in, which is going to slow that claim down. Even though we say it's a homeless claim, we heard up, we got it to SSA, but if it wasn't done properly, it's still going to get slowed down. Okay. I think we addressed everything.
Okay, great, thank you. And thank you for those questions. So don't worry, y'all, we're plugging through, we're almost done. So a lot of the slides in this section we've kind of like already talked about as well, just kind of like during our conversations and things like that. This one I do just want to kind of briefly highlight it again, because this is what Daz was referring to earlier when she was talking about kind of like setting yourself up for success in terms of identifying appropriate candidates for disability. And I oftentimes think of, again, I go back to, you know, my mental health recovery center that I worked at, actually still work at part-time here in Buffalo, New York. And when I first got trained, and you know, the mistake that we made, and when I find that it's common, is our agency served a significant number of people that were experiencing homelessness. And when they learned about SOAR, their initial thought was like, oh, all of our people can like really kind of do this and qualify, because they all should like qualify for SOAR, right? Because they're experiencing homelessness, right? And of course, like me being their sole SOAR person and not even a dedicated position, it was just doing it in addition to all my other duties, it wasn't sustainable. It didn't really work at first, right? Because it's like SOAR applications are labor intensive. They're valuable. The outcomes are absolutely worth it. But I would never sit here and not say that like SOAR, they're at least on the front end, right? The front end are labor intensive. So it's like doing all of this work for applicants that likely were not already, like that were not necessarily good candidates, right? And I think the issue is that oftentimes when we're evaluating whether someone's a good candidate or not, a lot of agencies or individuals, the first question they ask is the person experiencing homelessness? And that really should not be the first question, because homelessness is a circumstance, it's not a disability. And just because someone's experiencing homelessness does not mean that they have a severe enough condition to qualify for disability. Or perhaps, and unfortunately for many of the individuals that I served, they may have had impairments, but their substance use was material to those impairments. So they weren't good candidates. You know what I mean? So the first question when you're evaluating if someone's a good candidate should not necessarily be, is the person experiencing homelessness? The first question really should be, does the individual have a disabling condition? And then outside of that, are they also experiencing or at risk of homelessness? And if the answers to those are yes, then they are likely a good SOAR candidate. And if there is anyone on the call who's like a SOAR provider and they're like, oh, when you said that, that gave me trauma because that's what I'm currently going through now, and you need us to kind of like help talk to your agency and help them understand that, reach out to Shandraia or myself. Don't worry, we got you, girl. We'll help you. We'll help them understand. We don't want you to be stressed out. So I'm not really going to go through the full like steps to completing an application. I think the important thing that really you need to know is that, like we stated, SOAR applications are about putting together a complete application. So when I said like it's labor intensive from the front end, right? It's not like your traditional application. It's not like your traditional application where it's like you got somebody who might need help applying for benefits and you're like, okay, I'm going to help you schedule an appointment. I might help you get there. Let me know what you need. you know, whatever, right? It's the SOAR process really kind of involves filling out the forms, collecting the medical evidence, writing your medical summary report, getting your co-signature if you can, and submitting it. And once you have those things, submitting it to the SSA office. So you're submitting everything in one packet, which again, kind of makes the process faster. And I can't remember who it was, but to the person who stated like, well, if you write homeless on it, it gets expedited anyways. That is true, but the process is still made even faster, right? Because you have included the necessary information and forms, right? Because I can mark, let's say like a non-SOAR application, right? I can mark on there that like this person's homeless, and yes, it's getting the flag, but that means that the DDS examiner, right? They still have to try to collect the medical evidence. They still have to try to like do all these things. So it's still kind of like, do you know what I mean? Yes, it's kind of going to the top of their priority, but those are still things that they have to do. So imagine now how much time, how much like faster that application is, because A, you marked they are homeless and they got the flag, and B, you have provided them already with what they need. It is even faster. I think the important thing to know with the SOAR process is that the average amount of time that's taken, so from the time that you start, so from the time you set the protected filing date meeting to the time you get a decision, on average, cumulatively, is between 90 to 120 days. Now, obviously, there are some things that might intervene that might make an application a little bit longer. So I think like we saw the average days to decision in Austin was like 153 days, which still isn't bad. But like with COVID, right, things in general nationwide are slower now, right? Or there may be specific community things that make things slower, right? So like, but in general, the process from 90 to 120 days. And then we've talked about like SSA and DDS, but we just want to emphasize that SSA and DDS are partners. And again, you all in Texas get to kind of reap the benefits of those that really kind of worked with SSA and DDS to establish specific contacts. You have a specific unit at your DDS office that handles SOAR claims. That is not something many communities have. So really being able to regularly communicate with your claims representatives as well. And if barriers arise with that communication, please feel free to reach out to Shandraia or the state team lead or myself. Now, in terms of like other considerations, right? Because like we're saying, like you want to make sure that the person is an appropriate SOAR candidate. And there may be like some individuals that have like certain kind of like conditions or fall under certain circumstances where SOAR may not, you know what I mean? Like that's not the best process for them. Do you know what I mean? Or they don't, I mean, I believe that SOAR is good for anybody, but what I mean by this is that they may be able to get like fast tracked even more than that. So just like a few examples that I'm going to point out here, I'm not going to like literally go through and like train and talk about all of them, but like be aware that that's what they are. So aged individuals, those that are 65 and up. So once somebody hits the age of 65, they are not necessarily, so when somebody turns 65, they're technically entitled to SSI benefits, not necessarily SSD, but SSI benefits, right? And the thing is, like once they hit 65, they're not even really applying for disability benefits, they're applying for what's called aged benefits. So if you have an individual, they're 65 and up, they really just kind of need to submit the SSA, the SSA 8000, the SSI application. They really just kind of need to submit that. They do not need like all of the kind of like additional medical evidence to follow, right? It's only if somebody's under 65, you have to prove that they are disabled enough that they need the benefits. But if someone's 65 and up, they're entitled to it. Now, be mindful, there are like some really small kind of like circumstances that might affect a 65-year-old's eligibility, really small things. Like I remember I had somebody and he wouldn't qualify because of his living circumstance. He was living in like not a group home. Oh my goodness, somebody help me. What are those called? Like when somebody's kind of like recovering and they're living with like other people.
Assisted living?
No, it wasn't even that.
Boarding home.
Thank you, whoever said it. Yes, that's what they were living in. It was something, yes. It was run by Salvation Army and it was like, yeah, so that he couldn't qualify because he was there. So there's like these small little things, but for the most part, anyone who's 65 and up, they're gonna qualify. There are also compassionate allowances. So this is for individuals, you can kind of like group Terry cases with these two, that you kind of group together. But these are for individuals that have really kind of like serious conditions where it's kind of probably pretty obvious that like they're gonna meet the listings. So SSA, they still need like the medical evidence to prove it, but like they're probably most likely gonna like approve those people up front. Do you know what I mean? So like they will approve, they will approve those individuals up front. And I think for some cases too, especially with compassion allowances, like even if they find that the person didn't provide the appropriate like evidence, they won't make them pay it back or anything. You know, if you go on the SSA website, they've got like literally you could flip through and like look at the different conditions that fall under that, but think of kind of like end stage type, you know, medical conditions, things like that. The VPAP initiative, I believe, is still around in Texas as well. The VPAP initiative really kind of looked at a number of different kind of communities or populations that when COVID hit, had barriers in terms of submitting applications. So it's kind of like an initiative from the SSA office to work with agencies to kind of train on how they can assist with those individuals with submitting applications. Note that it is not like in depth with as SOAR is, but it's more so a matter of being able to like refer people to the SSA office to get like an application in. And another thing too, like hopefully I kind of worded this in a way where it's not confusing, but if somebody has like a condition that like if you were looking at the Blue Book listing for it, and in order for that person to meet that listing, if it's something that like requires just really, really straightforward technical evidence, and it doesn't really require like an explanation of functioning, that person, you know what I mean? That's a person where like you may not necessarily need to be doing like an MSR and all those things. And I think a really good example of that is like blindness. I was talking to somebody the other day and they were like, yeah, she has blindness. I'm like, okay, partial blindness or whatever. He's like, no, total blindness. And I'm like, okay, stop. You don't need to be doing all of this. Like, so again, those are kind of some other, just kind of like considerations or things to think about if people fall in those categories. They may not necessarily need, it's not that they're not good candidates, it's just they don't need to necessarily have all the pieces that make up SOAR. And I know too, like sometimes like in other communities, you know, they may follow like their own kind of, I don't know, protocols or their own kind of like disability processes and things like that. And you know, that's all good. I'm not here telling somebody what to do and what not to do, especially, I mean, especially if it's working. If it's not working, I might kind of give them some guidance on, you probably shouldn't do that. But if it's, you know, working, but like I stated, if that is something that you're doing, you're not really following the SOAR model, the application is not to be labeled as SOAR and it's not to be submitted to our SSA and DDS contacts. And I would also encourage you too, like as a community, because I know Austin is so big as well, that if you are kind of looking at like the different kind of disability processes that individuals are using across the city, I think like some of the things that might be helpful and kind of like looking at or thinking about what's going to work for us or our agency is, again, really kind of looking at like, A, not only just like the process or what's involved, but B, what are the outcomes? Like, is it working? I would say like the main things for me when I'm looking at something is like, who is it helping and how effective is it, right? What are the outcomes? Have we seen the outcomes? How do the outcomes look? How are the outcomes comparable? Because as I stated, and if you need this, SOAR is something that has been statistically tested, not means tested, sorry, but like statistically tested for like 2 decades. And if that's information that you need, I would be glad to provide that for you. But it's like, again, in consideration, look at, okay, here are the outcomes, here's the process. We know that this has worked, here's the outcomes, even from our own community that show this. What are the outcomes of these other, I don't know, systems, protocols, whatever that we might be looking at or considering? What are the outcomes? Is it working? And like I said, too, don't forget this too. Another thing too is like, who is it helping? Who's it helping? And I know, you know, you all at the COC law, Shandraia, to echo, like you all kind of have evidence from the point in time count or, you know, just from your own information in terms of like where the needs are in Austin, right? So like maybe if there are population gaps that are being missed, where the needs are, but really kind of looking at like, okay, is it hitting or helping who needs to be helped? Because I remember one time I was talking to somebody in my community and we were kind of talking about their approval ratings. And like I said, I'm all for success. If it works, if it ain't broke, don't fix it. If it works, keep doing it. But, you know, when I was kind of like looking a little bit like deeper and like kind of like asking like, oh, that's great. That's great. So like, you know, how do kind of like referrals and stuff work for yours? And, you know, how do you target, you know, the people at our local bridge and stuff like that? And he basically kind of mentioned that like the people that they were, I hate to word it this way, but like the reason their outcomes were so high was because they were doing applications for people that obviously would have gotten approved, like regardless. So kind of like, you know what I mean? Some of like these other considerations that we were talking about, like obviously if you work somewhere and you're, let me see, obviously if you work somewhere and your target population are like older individuals, right? Because this is the aging and unhoused work group, right? So many of you might work at agencies where like, I don't know, people are 65 and up. Like yeah, your numbers are probably going to be higher because you work with people that are likely already going to be approved or SSA is already going to be lenient to. But are you helping the individuals that are 40 years old and living under the bridge? Or the people that have like the complex cases, right? Who haven't had a lot of treatment because they believe doctors are trying to poison them, or who are hard to engage. Do you know what I mean? So like, that's why I'm saying like, look at the need. So is that system who is it helping? And what are the outcomes? And is it effective? Don't worry, y'all, this is the last part. We're almost done. Daz, you want me to just take it home with these last 2 slides? Or do you want-
Totally up to you.
Okay, and I think too, you know what, Daz, I'm just gonna take it home so that I can finish them out because I feel like we've talked a lot about these already. So typically in terms of like when we're looking at SOAR initiatives, again, see, we're just having a conversation and just hitting all the slides. Here's the thing, I encourage you all, like we said, be reflective and be open and honest. Kind of ask yourself. So when someone in your agency is in need, and you know, again, and they want to apply for SSI and SSDI, what do you currently do with them? Because in this field, we are caring individuals. And like, even if somebody's not doing SOAR, like they're trying to help that person in some way. I know it, right? We're not just letting people be like, you're on your own. Someone's trying to help them. So really kind of looking at your agency or yourself, what do you currently do and how is that going? Again, determine the volume of the need and determine, you know, again, like, you know, how SOAR has been or could play a part in that. As we stated, SOAR can be labor intensive. Anyone who's doing a SOAR assisted application needs to be SOAR trained through the SOAR online course. The training is comprehensive. It's not one you could just throw on while you're doing laundry in the background. Not that I'm guilty of that, of course, or anything. But it does take about like 20 hours because it's comprehensive. We want people to feel trained and competent and comfortable with what they're doing. And aside from that, doing an actual application, we expect that it could take anywhere from 20 to 40 hours over a 60-day period. When I was looking at Shandraia, I believe the average amount of time that people put in for Austin of how long it took was like 30. So kind of like right in the middle. It really depends on the setting you work. If you work at a place where you have access to a lot of the critical components, for example, in-house providers who can sign the MSR, or if you work in like a prison, so you have easy access to the population, you don't got to go search for them under bridges like I did, you're probably going to be on that lower end. It's probably going to take you like only like the 20 hour. Whereas if you're in a environment where you have to do a lot of engagement, you're probably going to be on the higher end of like, you know, how long it takes. And again, lastly, just really kind of thinking about in terms of resource and time allocation. I know a lot of people oftentimes like to ask about like funding, and trust me, funding is literally an hour and a half. It could be like an hour presentation all on its own. So what I am going to say is this, I feel like this is the important takeaway. SOAR absolutely fits under many federal, state, and local sources of funding as a creative solution for reducing homelessness. As we all know, income is, for many people, is like the #1 barrier, right, for maintaining or obtaining housing. So it could fit under such federal programs as CDBG grants and mental health block grants and HUD funding and the TIEH and PATH funding and all those things, right? As well as like kind of more non-traditional or ones you wouldn't really think about, such as like YHDP or utilizing AmeriCorps workers or looking at like Medicaid or even Texas, looking at Medicaid and looking at partnering with like county DSS office. There's so many. And like, again, I can like kind of give Shandraia, I can send you like the funding sheet list. If you want to send that out to people who were here, you can look at it. But the main takeaway too that I want you to kind of take away from that too is, yes, SOAR does fit under many sources of funding, and Austin would know because y'all have a lot of funding. I just thought about it for SOAR specific positions. A lot of communities don't. See, I automatically think that. But SOAR can absolutely still be done, like even if there isn't a specifically funded position. It really just kind of requires kind of like looking at the resources that you have and seeing if it's possible to kind of reallocate either duties or time, or kind of like, you know what I mean, creatively kind of looking at that. So maybe saying like, hey, 1 or 2 staff, maybe these are going to be our SOAR trained people, and they have a lesser caseload because they are, you know what I mean, they're doing the SOAR cases, which tend to be people with the more complex needs. Do you know what I mean? So again, really just kind of looking at like what resources that you have and what could maybe be like creatively reimagined or reallocated. And these are just some next steps. We encourage you all to continue the discussion. I know you were going to have a listening session. It's like 1:29, and I'm sure you can't do that in 1 minute. So I greatly, greatly apologize, but I do hope that the information that we gave at least helped to answer some of the questions that you had. And like Shandraia said,
Hey.
like people maybe, oh, I'm sorry, Des.
No, I just wanted to quickly
Yeah, go ahead.
address, there's
Go
some
ahead.
communication about collecting medical records, the significance of the critical components, and is it even worth it to, or does the claimant, is the claimant better off submitting an app without the SOAR rep if they're spending a lot of time making sure that all the critical components are in place? Can reps take a back pay for SOAR applications? Can you get SOAR training if you work in a broad geographic area, for example, a large part of the state? How does it work in terms of SSA contacts? First off, with SSA contacts, please reach out to the SOAR local lead. And I'm
Yes.
assuming, yes, just
Yes.
get, make sure that we share information and resources with regard to that.
And- and
Secondly,
Mhm.
I'm sorry.
Oh, and if you're a SOAR representative, then you have that information. If you don't, contact me, but we give that information to our SOAR representatives so it can expedite our claims. Okay, sorry, Dazara. Mhm.
That's okay. And secondly, I cannot think of a situation where a SOAR, a person with serious mental illness or disabling conditions would be better off without a SOAR provider. If you're following the SOAR model, you have a very limited amount of time to get that application in, right? It's going to be, you have to put it in. I mean, you have to put it in within that time frame. If you are, and I'm speaking primarily from the experience of working with people with severe and persistent mental illness. That was primarily the population that I served. It's hard enough to navigate the Social Security process without a serious mental illness. It's hard enough. I can't imagine what it would be like for someone to go and apply on their own without assistance if they're hearing things that other people can't hear, seeing things that other people can't see, or experiencing such anxiety that they can't even go into the office themselves. I have worked with people like that a lot. And so I can't think of specific examples of what that could look like. So Dylan, if you want to have a conversation off this recording, then I'm happy to have that.
Well, if I
So
could add too, Des, sorry, if I could just add, and I promise I'm not being funny. I promise I'm really not being funny, but like, if that was the case, like if a person would be better off applying without the SOAR provider, wouldn't the approval ratings look higher and be better than what they are? Because most people apply on their own initially, right? And that's where that 29.8% approval rating that comes from SSA publicly on their website in their data set tables, that is where that is from. That's what it currently is 29.8%, and that's for the general public. For those individuals that have the severe mental health conditions we're talking about, that's where that 17% number is. Well, with the conditions and experiencing homelessness. So like you're saying, Daz, like and again, like I said, I'm not saying that to be like funny, whoever asked that question, but it's like, if that was the case, we would most likely see higher numbers generally.
That's right. And we are recording this, so I'm gonna answer a few more questions and see if we can post this on the ECHO site so people can go back and view it. It was a question about where can I find someone to do a SOAR claim? Basically, that was the question. So in the past, a lot of the funding was tied to certain programs, and that seems like that's what you was experiencing. Right now, we're trying to eliminate that. We're trying to give funding for SOAR that's not tied to certain programs, so more organizations can help people throughout Austin Travis County. If you come to the SOAR work group, that's one of the main topics that we're trying to create a pilot program. We do have some organizations that's working beyond their borders, beyond their organization, that's taking in clients. Sometimes they have room for 2, sometimes they have room for 10 clients, but we're trying to actually really establish it. So please join and help us get that up and running. In addition to that, it was another question about what if someone doesn't have any medical records? Why do I need to wait a long time before submitting their claims. If you really know the listings very well, you would know maybe someone on dialysis, you're not going to have to wait because we're just going to need that one form, or like someone with COPD, if you know the listings and it's determined by the body weight, the height, you can look at the person. If you're kind of used to working in the field, you know, okay, let me book this appointment, let me ask for this one referral, and they're going to get approved. So it's a give and take. With that question, it's according to the limited functioning, the diagnosis, how
Well,
much knowledge you have in that field.
Can I ask you, Shandraia, and again, I promise I'm not being funny. I promise I'm really not. But like, what is the benefit to submitting an application faster without the quality? Do you know what I mean? Like what is the benefit? I guess that would be what I would want to understand. Like, what's the benefit to submitting, like, oh, I can get it in quicker, but like the quality and the necessary pieces still aren't there. So yeah, you're getting it in faster, but like, is the necessary information in there for you to get the approval? Because for me personally, the approval, the outcome is more important than getting it in quickly. I'm sure, and trust me, and again, like I said, I come from a place of like being the only person at a nonprofit doing this without funding. So trust me, I understand there's probably a lot of pressure from like the applicant and the client because they don't understand the things that we do about quality. So I know like I used to get a lot of like, no, just go ahead and put it in, and like really having to kind of explain to people like why it was important to collect evidence and things. But again, I really encourage you to like be reflective of and think about that. Like, what is the benefit of getting it in faster versus like, do you know what I mean? Like, shouldn't the outcome and the quality of the application be more important than getting it in faster? And I think too, like, Shandraia, sorry, really quick, because I didn't mean to cut you off, that was rude. But the thing too, like with the SOAR process as well, is like the first step is setting the protective filing date. Once you set that, you've got 60 days to get everything else that you need. So when we talk about time frame here, we're not saying, I don't know if there are any kind of like crazy rumors around like SOAR applications taking a long time, but like when you set the protective filing date, you got 60 days. So like we're talking about a 60-day time frame, 2 months. It's not, again, I don't know if there are thoughts about like that it was longer than that, but it's a 60-day time frame.
Mm-hmm. Thank you, Sametra and Dazara. And also I want to say, SOAR representatives, this is a free service. We don't get paid for this. We don't get any back pay or anything like that. I think that was one of the questions. Okay, is the application date not tied to the back pay date? It is for SSI claims, and for SSDI claims, maybe not. It's a little bit more to that. I don't have time to break it down and explain it. Again, I was an examiner, so I know all about it. But we can always talk later about that. Thank y'all so much. We appreciate everything. I think we answered all of the questions here. And then we do have upcoming trainings that we're going to be sending out with SSA. It's going to come along and train on some of those things that Sametra presented in the PowerPoint. And then we have some training ourselves from ECHO. Thank you so much. We appreciate all of y'all for showing up. Thank you, SAMHSA.
Absolutely. Have a wonderful day, everyone.
Thank you, everyone.
Bye. We do apologize for taking up the time for the listening session. But if people have like, do have like comments and things like that, like Shandraia said, maybe like emailing them, or I don't know if there's another forum, because I do think it's important to have had that. So I apologize for not leaving enough time.
You're good. Thank you so much.
No problem.
We appreciate y'all.
Bye.
Bye.